Hi, in this video, we're gonna talk about COVID-19. What to expect if you are hospitalized due to COVID-19. First, let's have an overview of the disease. Coronaviruses are a wide family of viruses that can infect both animals and humans. Several coronaviruses are known to cause respiratory infections in humans, spanning from the common cold to more serious diseases such as Middle East Respiratory Syndrome or MERS and Extreme Acute Respiratory Syndrome or SARS. COVID-19 disease is caused by the most recently discovered coronavirus, and the name of this virus is SARS-CoV-2. Before the outbreak in Wuhan, China, that was in December 2019, this new virus and disease are unknown. COVID-19 has now become a pandemic affecting many nations around the world. According to the World Health Organization, most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. How does COVID-19 spread between people? When an infected person coughs, sneezes, speaks, sings, or breathes deeply, the virus may spread in tiny liquid particles from their mouth or nose. These liquid particles range in size from larger respiratory droplets to smaller aerosol. Other people will become infected when COVID-19 virus enters their mouth, nose, or eyes, which is more common when they are immediate or near contact, less than 1 meter apart with an infected individual. The majority of patients who contract COVID-19 are likely to recover at home without the need for medical attention and hospitalization. Individuals with more acute forms of the disease, on the other hand, may require hospitalization. Patients with COVID-19 come to the hospital for a variety of reasons. Some people are rushing to the hospital because they are having shortness of breath, and others are getting treatment for stomach problems such as lack of appetite and diarrhea. Another common reason people go to the hospital, particularly adults, is dizziness, confusion, or a sudden change in mental state, and this is because of a decreased oxygen level in their blood. Now, what happens once a patient with COVID-19 is admitted to the hospital? Nowadays, it's normal for hospitals to have varying degrees of COVID care unit, where patients with mildly severe symptoms undergo care, though in an isolation ward where staff members wear masks and other types of personal protective equipment. It's the same as if the patient taken to the hospital with a common illness and not critical. However, they were going to treat that patient as if he has or she has an airborne disease. So, if a patient hospitalized for COVID-19 but not critical, he or she will likely end up in an isolation ward or COVID unit. The type of the treatment he or she will receive is dependent on the severity of the symptoms. Since there is no cure for COVID-19 at this time, hospital care for coronavirus is based on what is known as supportive care or intervention to protect the body's vital organs and preventing from deterioration and further complications. The doctors, nurses, and patient care associate will monitor patient's oxygen level and administer care to ensure that the rest of the body has a sufficient supply of oxygen. Some patients only use a nasal cannula, which is a tube that is placed into the nostrils to provide oxygen. Some patients necessitate the use of an oxygen mask that can contain high doses of oxygen. The vital signs of the patient, such as heart rate, blood pressure, number of breaths per minute, body temperature, are monitored by hospital staff to detect any emerging complications. A patient whose heart rate rises as their blood pressure falls may be suffering from heart disease or sepsis. Staff will most likely perform blood tests and administer IV or intravenous fluids and medication or antibiotic to help heart works and prevent sepsis. Some patients will be able to eat and drink normally, while others will be unable to do so. So, if necessary, hospital personnel may administer nutrition directly into patients' veins with an IV. A significant part of patient care in a COVID unit is monitoring the patient's symptoms to see if they seem to get worse, and keeping an eye out for any new symptoms that are alarming. If the condition of the patient escalate, or if they arrive at the hospital in a more serious condition, the physician will most likely send them to the intensive care unit or ICU to be closely monitored. The conditions that most often necessitate critical treatment are serious respiratory compromise or significant cardiovascular compromise. So example of this is if you have very low oxygen and if you have difficulty of breathing, really difficulty of breathing, okay? If you cannot breathe properly, and if your blood pressure is low, and if your heart rate is really high, so most likely you will be admitted directly to the ICU. Okay? All right, then another reason why you should be admitted in ICU is if your respiratory condition deteriorates while you are in COVID unit and need to modify the invasiveness of the oxygen treatment, then probably you should be admitted to a critical care unit, okay, if you are a COVID patient. Okay, once the patient in the ICU and unable to breathe properly, the doctors may advise intubation or insertion of a breathing tube into the patient's airway and put on mechanical ventilator. A ventilator is a machine that forces air and oxygen into the lungs. Critical care providers may also prescribe medication to keep the patient sleepy and comfortable while on ventilator. If the patient's condition improves, then the medical staff will eventually wean the patient off the ventilator. Okay? Now, all right. Just because someone is admitted to the ICU with breathing problems doesn't mean they'll be intubated and placed on a ventilator right away. Ventilators will not be the treatment going forward. That's because new evidence suggests that when it comes to coronavirus cases, ventilators might not necessarily be the best option. Less invasive oxygen therapies, such as high-flow nasal cannula, have been found to be effective in treating some COVID-19 patients, particularly when the patient is positioned on their stomach, or we call this prone positioning. This procedure provides warm, humidified oxygen to the lungs through the nose, avoiding the potential lung injury caused by mechanical ventilator. Okay, so what was the cause of death for those COVID-19 patients in the hospital? Data on the clinical features and causes of death for COVID-19 patients are still limited. COVID-19 has been associated to more than 2 million deaths worldwide since the pandemic, right? Patients that are older who have pre-existing underlying health problems such as ischemic cardiac disease, diabetes, chronic obstructive pulmonary disease, and obesity are at a greater risk of fatal disease outcome. However, thorough research on the causes of mortality and the relation of pre-existing health problems to death of a COVID-19 patient is still lacking. The collective information on the cause in death of a coronavirus patient is still being relied on autopsy, although it seems that acute respiratory failure and sepsis were the primary causes of death. So, how does coronavirus kills? Through sepsis and acute respiratory failure, particularly acute respiratory distress syndrome or ARDS. Okay, let me explain this too. Any kind of infections, bacterial, fungal, and viral infections like COVID-19 can potentially lead to sepsis. Sepsis is a potentially life-threatening condition. When you have a sepsis, your body immune system or body's response to an infection damages its own tissue. When that happens, it will cause organs to function poorly and abnormally. This will lead to multiple organ failure and ultimately death. COVID-19 do cause pneumonia. It's an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, a purulent material, causing cough with phlegm or pus, fever, chills, and difficulty breathing. When all of the sacs or entire lungs become inflamed, this is called ARDS or acute respiratory distress syndrome. Imagine if that happens, if the body is unable to deal with the condition despite medical attention and assistance, there would be a gas exchange problem or no gas exchange at all, which lead to death. Okay? I believe I've covered the general situation of what will happen if you are hospitalized due to COVID-19. The details in this video are most likely similar to the ideal scenario. However, a variety of factors can influence the delivery and efficacy of COVID-19 treatment in the hospital. As an example, consider the number of patients, or how many patients going to the hospital to seek treatment from COVID-19. The availability of services and equipment, like for example, the availability of COVID unit and mechanical ventilator. Okay, and the number of medical personnel. So most of the hospital nowadays are understaffed. Okay, we don't have enough nurses, we don't have enough doctors. That is one of the reasons why the frontliners are pleading for you to comply by wearing a mask, social distancing yourself, hand washing, and if possible, staying in your home. Okay? Thank you so much.